Hi, good morning Nathan. My name is Sylvia Marcus. I'm your invigilator for the OET-speaking session on the 18th of July 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Nathan Midfield.
And what is your candidate number, please?
My candidate number is 232891188.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are some of your personal qualities that you believe will help you succeed in nursing?
I value hard work and honesty. I always try to demonstrate those qualities in everything I do. I tend to have a naturally inquisitive nature, which I think will help me as I grow and learn in nursing school and beyond. I believe that if I can be honest, work hard, and learn as much as possible, I can succeed in my nursing career.
Is there anything you would like to improve about yourself?
I'm sure I could think of several things I'd like to change. But, as I consider becoming a successful nurse, I think the first thing I'd like to improve is how I manage my time. I understand nursing is demanding. So, I really want to work on ways to capitalize on the way I prioritize tasks and use my time wisely.
What do you consider your most positive trait?
I think one of my most positive traits is my ability to find the good in things. We all have bad days, but even when things aren't going exactly as I want, I try to look at the big picture and find ways the situation could work out well. I hope to carry that same outlook throughout my career, so that I can be a source of encouragement to my patients and their families.
Do you feel you're more of a leader or a follower?
Honestly, I believe I may be a bit of both. I'm not afraid to accept leadership challenges, but I'm also smart enough to know that there is always something new to learn and value the leadership others bring into my life.
What do you think is the most important trait a nurse should have, and why?
I think there are a lot of essential traits nurses should demonstrate. For example, I believe patience, empathy, and compassion are among some of the most important traits. Being sick and needing medical care can be scary. When nurses demonstrate these traits, I think it helps patients feel more at ease and leads to better experiences for everyone.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Good morning, Sylvia. I'm Mick's attending nurse Nathan Midfield here. I'm here to confirm to you that Mick is ready for discharge. I would like to discuss your concerns if you have one.
Nurse, I think it is too early to get a discharge for him.
May I know the reason behind your concern in detail?
I am very much concerned about my son's pain. I don't know how I will manage Mick after his discharge.
Sylvia, I can realize a mother's concern. I can confirm that the hospital stay is not necessary after the tonsillectomy. If the recovery is satisfactory, the patient will get discharged. It is the standard procedure we do for all the patients. Here, Mick's condition after the procedure is satisfactory and hence he is getting discharged.
Okay.
Let me explain the symptoms that Mick may experience for a few days. It is normal to have a bit of pain for which pain medications will be provided. In addition, the pain can persist for 1 to 2 weeks. But if Mick reports intense pain, definitely you should seek medical help.
Definitely, nurse. I'll take care of him.
That's perfect.
Beyond that, do I need to take care of anything else?
I appreciate your consciousness. I will explain some of the after effects of tonsillectomy. It is quite common to have pain in the ears, neck or jaw. Mick may experience nausea for several days and may vomit. Mild fever can also be expected. Convince him if he has bad breath which will fade away in a few days' time. He may also have swelling of the tongue or throat. I would also like to convey other difficulties your child may suffer. He may feel something has stuck in his throat, and he will also have anxiety or sleep disturbances for some days.
Is the procedure this complicated? How I will manage my son at home, without any assistance?
I can understand your emotions. It is not mandatory that Mick will suffer all these after effects. Moreover, you will be able to manage him with medications symptomatically.
All right, please guide with medications?
Sure, I will guide you with post-discharge care. The medication will be prescribed by the doctor and should be provided to Mick as directed by the surgeon. Apart from that, he needs to stay well hydrated. Kindly make sure he consumes fluids adequately. Consuming plenty of water will avoid dehydration and he will feel settled. You can also consider water and ice pops etc. to hydrate him.
All right, I got it.
Proper rest is also essential for his better and fast recovery. It is recommended to take bed rest on the initial days, and no strenuous activities for the first 2 weeks to enhance healing and avoid complications.
I will ensure this. Well, what should he eat and drink?
Your question is thoughtful. I'll explain the dietary regime to you. Since he underwent the tonsillectomy, the dietary regime has an important role in the aftercare. Consider providing him with foods that are easy to chew and easy to swallow, so that he won't feel it is difficult and painful to have. You can also provide ice cream and pudding if he can tolerate it. I strongly recommend you to avoid foods that are acidic and spicy. Until he makes good progress, it is better to avoid hard or crunchy foods.
I will consider the foods you suggest.
Good to hear that. Do I need to address any more concerns of you?
Actually, nurse, he is very active and has many friends. When the visitors can be allowed and also when he can rejoin his school.
I am glad to hear that Mick is a very active kid. There are no restrictions for healthy visitors, however, avoid visitors with communicable diseases such as people with coughs and colds, as there is a chance of getting an infection. It is also recommended not to strain him too much as he needs rest for a better recovery.
I understand that.
He can return to school once he is stable. That means once after he resumes having a normal diet, and secondly after he gets adequate sleep as he normally gets. And thirdly when he no longer needs pain medication, he can restart his school and other activities.
That gives me a very good insight.
I am happy to hear that. I would like to notify you about situations when he requires medical attention.
Please let me know those situations.
If Mick suffers from bleeding, it is a medical emergency. See the doctor if he has a high fever. Signs of dehydration are also to be handled cautiously. If he has breathing difficulty, contact the hospital for medical assistance.
Okay. I will watch out for these complications.
That's perfect. I hope I have cleared up all your concerns. If you have any questions, please feel free to contact us. I wish your son a speedy recovery. Thank you.
Thank you. That is the end of your OET-speaking role play. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.